Hello and welcome to the topic non-alcoholic steatohepatitis, or also known as NASH, in the module Gastroenterology and Hepatology. By the end of this topic, you should be able to define NASH, explain the pathophysiology of NASH, describe the clinical presentation of NASH, outline the investigations in the diagnosis of NASH, and finally discuss the management of NASH. Let's get started. Steatohepatitis is a type of fatty liver disease characterized by inflammation of the liver with concurrent fat accumulation in the liver. More deposition of fat in the liver is termed steatosis, and together this constitute fatty liver changes. NASH particularly refers to non-alcoholic steatohepatitis, where the underlying cause of this condition is not caused by alcohol. NASH is a common cause for chronic liver disease strongly associated with insulin resistance leading to fibrosis. No factors that determine increasing fibrosis have been well recognized. Non-alcoholic fatty liver disease, or NAFLD, and NASH are both linked to the following, which are overweight or obesity, insulin resistance, in which the type of cells don't take up sugar in response to the hormone insulin, hyperglycemia, and this indicates prediabetes or type 2 diabetes. So NASH particularly is the inflammation of the liver and the damage to the liver cells caused by buildup of fat in the liver. It comes as a part of the group conditions called fatty liver disease. The pathophysiology of NASH is complex and includes multiple parallel hits. It's notably characterized by steatosis as well as evidence of hepatocyte injury and inflammation with or without fibrosis. NASH is frequently associated with type 2 diabetes and conditions associated with insulin resistance as mentioned earlier. Specific risk factors that we want to consider would be diabetes, high cholesterol, high triglycerides, poor diet, metabolic syndrome, polycystic ovarian syndrome, sleep apnea, and also hypothyroidism. Among the symptoms of NASH would be easy bleeding or bruising, and this indicates a dysfunction in the coagulation factor, which is reflects the synthetic function of the liver. Having itchy skin, yellow discoloration of the skin or jaundice, fluid accumulation in the abdomen or ascites, loss of appetite, nausea, and also lower limb edema. So particular signs to look out for, as mentioned, you might want to look out for abdominal pain or feeling fullness, tenderness on palpation, nausea, loss of appetite or weight loss, jaundice, and edema. There might be other additional signs where patients could have extreme tiredness or mental confusion, and this is when the severity of the liver involvement is high. Patient could also complain of weakness and sleep apnea given the risk factors that they have. So NASH may be suspected if blood tests show high levels of liver enzymes or if the scans show fatty liver deposits. Blood tests such as liver function tests that measure inflammation of the liver can be done, and NASH is suspected if the blood tests show high levels of liver enzymes. NASH is diagnosed by examining a small piece of the liver taken through a needle, which we call a liver biopsy. But NASH is diagnosed when examination of the tissue with the microscope shows fat along with inflammation and damage to the liver cells. If the tissue shows fat without inflammation and damage, simple fatty liver disease or NAFLD is diagnosed. Abdominal ultrasound, which is often the initial test when liver disease is suspected, is carried out. CT scans or MRIs of the abdomen are other modalities to look at the liver in more detail. Abdominal ultrasound is widely used for screening asymptomatic patients with an incidental elevation of liver enzymes. In contrast, ultrasound and CT have limited accuracy for diagnosing mild hepatic steatosis and have intra- and inter-observer variability. The first line of treatment for NAFLD and NASH is weight loss, done through a combination of calorie reduction, exercise, and healthy eating. Weight loss can reduce fat and inflammation in the liver. The following lifestyle changes are important in managing the disease. Now, let's summarize. Non-alcoholic steatohepatitis or NASH is characterized by inflammation due to fat accumulation in the liver cells. We have looked at the pathophysiology and specific risk factors that may carry a risk of NASH, the clinical manifestations one would have, not forgettingly to look out for signs of insulin resistance, as this has shown a correlation, investigations that can be carried out to look at the severity of the liver involvement, as well as an imaging to look at fatty deposits over the liver. Medical management is the mainstay therapy, where here we would advocate therapy to control diabetes and also statins for cholesterol level reduction. Apart from that, lifestyle changes are key to ensuring non-alcoholic steatohepatitis can be reversible. So we have come to the end of this topic. Thank you for your time.